Hello, how are you doing today?
I'm good. How are you?
Good. So this is the Pulmonary Rehabilitation booth. Are you interested in that?
Yes, I have COPD.
Okay. And what is your name?
My name is Miss Harv.
Okay. So there's a little assessment that we do to see if you qualify for our pulmonary rehabilitation. My name is Dawn. I'm a respiratory therapist at a local hospital where we have a really great pulmonary rehab program. And so this is just like a basic assessment to see if you qualify. So today, we'll put today's date. And what is your date of birth?
8/18/1962.
Okay. Can you tell me your address?
923 Southwest Land Avenue.
Okay. And who is your doctor?
Dr. Smith.
Okay. Do you have a telephone number you could give me?
615
Okay.
468
Okay.
7321.
All right. Is that your mobile number?
Yes.
Okay. All right. And what is your exact diagnosis? You said you had COPD. Is that like stage 1 or stage 2?
I have stage 2 COPD.
Okay. Do you have any other past medical history?
I have sleep apnea and I've had pneumonia twice.
Okay. Oh, that's no good. Okay. What about your occupation? What do you do for a living?
I'm a cosmetologist.
Okay, so you do hair. I'm sure you come in contact with a lot of chemicals and stuff there.
Yes.
It's not good for your lungs. And what is your level of mobility? It seems like you walk well.
Yes, I walk well.
Do you drive?
Yes, I drive.
Okay. And what type of medications are you currently on that the doctor has put you on for your COPD?
Albuterol, and I have an inhaler only when needed.
Okay, so you have an albuterol inhaler and you just use it when needed?
Only when needed.
Okay.
And then I take one puff of Formoterol 2 times a day.
Okay. All right. And are you on oxygen at home?
Yes.
Well, I'm seeing that you're wearing it now, so that answers my next question. What's portable oxygen? So yes, and how many liters are you on?
2.
Okay. Is that pretty standard? Is that what you stay on most of the time?
Yes.
Okay. And since you have the sleep apnea, do you wear a BiPAP at home?
Yes.
And do you know what brand it is? Or
It's the Air Curve.
The Air Curve, okay. Is that working pretty well for you?
Yes. My IPAP is 15 and my EPAP is 5.
Okay. Is that what you normally keep it set on?
All the time.
Okay. And do you smoke? Or have you smoked ever?
About 1 pack for 20 years.
For the last 20 years. Okay. And do you currently smoke or have you quit?
I quit about 5 years ago.
Oh, awesome. That's great. That's perfect. Because that is one of the first steps in helping you breathe better was going to be smoking cessation or learning how to quit smoking. Do you know what your current BMI is?
39.
Okay. And I'm just going to, I have this little thing, I'm just going to get a baseline on your heart rate and your what kind of SpO2 you have there with your oxygen on. And let's see, how far can you walk? What's your baseline?
About 100
function?
meters.
About 100 meters without getting really super winded.
Or out of breath, yes.
Okay. And what about when you go upstairs? What happens when you walk upstairs?
Very out of breath.
Okay. Uphill?
I get very winded whenever I walk up the hill.
Okay. And what about orthopnea, what about when you're laying down? Is it hard for you to breathe when you're laying down?
Yes, I can't breathe when laying down.
Okay, so you just prop yourself up kind of with a, more of a sort of sitting up position with pillows to help you breathe better?
Yes.
Okay. And do you have a cough real bad?
Very productive.
Okay, a very productive cough. Okay. What do you cough up when you cough real hard? Your
A
sputum.
clear and thick, substance.
Okay, so your sputum is clear and thick. You have a lot of secretions in there in your chest.
Yes.
And do you have a wheeze? Do you ever have a
Sometimes,
wheeze?
yes.
Okay. That's probably why you're on the albuterol. That helps with that. When you get wheezy. And what about some stress incontinence? Like when you cough or anything, do you ever get that?
Sometimes.
Sometimes,
Yes,
okay.
ma'am.
Okay. Let's see what you have here. Okay. Have you had a recent chest x-ray? And what did they tell you about your chest x-ray? About your lungs? What did they look like? They were hyperinflated?
Yes, ma'am.
Okay. Anything
Flat
else?
diaphragm.
Your diaphragm was flat.
Yes, ma'am.
That's normal with COPD, so that is to be expected. Okay. Okay, well that's our assessment. And what we do is we set you up on a plan for the pulmonary rehabilitation where you'll come so many days a week for an extended period of time, maybe 4 to 6 weeks. Is that something that you would be interested in doing?
Yes, ma'am.
Okay. Okay, well, it looks like you are going to qualify for, based on all this information, it looks like you are going to qualify, Ms. Harv, for some pulmonary rehabilitation. Okay, so now we're going to go over some of the benefits of pulmonary rehab. It's really great for people who are short of breath because it can really decrease that shortness of breath. It can increase your ability to be more physically active and be more social and do more activities, which in turn will make your quality of life better. It can promote some independence. You won't feel so much like you're dependent on people because you'll be able to get around better and all that. It also reduces hospitalizations. You won't have as many exacerbations of your COPD and emergencies, and that will reduce your costs in healthcare as well. So those are just some of, the benefits. It's just gonna really make your lungs better. You can't get rid of COPD, but you can definitely improve it. Okay, does that sound like something you're gonna be interested in?
Yes, ma'am.
Okay, great. Well, if it is, then we can start this Tuesday at 9 a.m.
Okay.
You're going to come to the pulmonary rehab clinic at the local hospital, and we will go over everything that we're going to do there, okay, that first day. All right? It was very nice meeting you, and we'll see you Tuesday, okay?
Okay.
Hi, Ms. Harv.
Hi.
How are you doing today?
Good. How are you?
I'm doing well. Thank you for asking. Okay, so the first thing, we're glad to see you here today. And the first thing we're going to do is talk about the times and the days that you're going to be coming and how much you need to come. So based on your assessment, I feel like you need to come about 2 times a week. And we're gonna start that today, which is Tuesday. And so does Tuesdays and Thursdays work good for you?
Yes. What time?
About 9 a.m., is that okay?
Yes.
If we can change the time, if that doesn't work good for you. So we'll do Tuesdays and Thursdays at 9 a.m. and we'll do that for the next 6 weeks. And we'll see how that goes. And then, this is what we call sort of more intensive program. And then you can phase out into more of a maintenance program after you complete this program, if you wanted to continue doing that and just kind of maintaining it. You take the formoterol at home and the albuterol as needed. So one thing I wanted to talk to you about with that is your technique that you use your formoterol. We have something called a valve holding chamber, and sometimes they're called spacers. There's another thing that they're sort of similar. And I actually have one of those with me today that I can send home with you. And this is something that you can use with your formoterol and your albuterol. And it just helps get the medication down in your lungs a little bit better. And how that works is you're just going to connect your MDI, your meter dose inhaler, into the end right here. After you shake it up and get it ready, you put it in here. You're gonna take the cap off and you'll make a tight seal. It's got a valve in here, it's like a one-way valve. And you're gonna make a tight seal with your lips, but make sure your tongue's not blocking it. Keep your tongue underneath it. And you're just gonna exhale normally and then take a deep, when you actuate your medicine, take a deep breath in. And that holds all that medicine in there, and it's gonna get it all down in your lungs really well. Instead of, just squirting it and it just kind of, you're losing a lot of the medication. So with that tight seal, that's gonna get a lot of medication down into your lungs a little bit better. So we're gonna let you take that home with you today, and hopefully you can use that with your inhalers. And another thing, have you ever used lung expansion therapy?
No, I have not.
Okay, do you know what it is?
No.
Okay, well, we have something that they use a lot now for different lung diseases and things, and to prevent lung diseases and prevent them getting worse. It's called an incentive spirometry. And it's just a little device. I have one here, and I'm gonna show you how to use it. And I can also send one of these home with you today, and you can use this at home too. And we can keep one here for you, and then you can just use it at home as well. But you are going to try to keep it, you're gonna just exhale as deep as you can, as much air as you can, and then you're gonna suck in as hard as you can through the mouthpiece, and you're gonna try to keep it in between this indicator right in here, where it says better. You're gonna try to keep it right there. And so you're just gonna inhale as deeply as you can through that, okay? And just try to get as much as you can. And it's just something to exercise your lungs, get your lungs in better shape. And then you just suck in as hard as you can. There you go, try to keep that indicator. Good. Okay. All right, you can just, like I said, you can just take this one home. And you can work on that, just keep it by your TV, just use it when you're not doing anything. Let's see. We're gonna do some different kind of basics exercises with you. The 4 types of exercises that we really wanna work on is, and probably the biggest one is endurance, just trying to get your body, built up to where you're not going to be so short of breath. Get your endurance built up. And you can do that, like we have treadmills and things like that, exercise bikes here at the rehab that you can use. And then we'll do some different types of upper body strength exercises. You can use hand weights. Also when you're at home, if you don't have hand weights, you can use bottles of water, and just work your upper body and do things like that. And then also with your legs, you can just do different kinds of exercises. and we'll show you all of those things while you're here. We're going to do a little test today, and it's sort of like just a walking test, just to kind of see where you're at and how exerted you get when you're walking, like on a treadmill for 5 or 6 minutes. And we'll just see if your oxygen saturation drops at all or any of those things. Okay, so I'm going to let you get on the treadmill, and we're going to let you walk for about 6 minutes and see how you do. And we're going to see if make sure that your oxygen doesn't drop. You're wearing your oxygen, so that's good. And we're going to get on this treadmill right here. Okay, and we're going to just let you walk for like 6 minutes. Okay. Okay, good job. All right. Okay, good. So you're getting a little bit out of breath. But that's okay, and that's what we're here to do, is we're going to get you in better shape and get those lungs in better shape, okay? So what we need to do now is just, I want to hear your goal. What is your goal for, your exertion goal? Like, what do you want to get out of this?
I would like to not be out of breath and not get winded when I'm walking upstairs or when I'm taking short walks.
Any questions about anything that we went over today?
Yes. How long should I exercise again each day?
Well, I think our goal is probably about 30 minutes every day. Of course, you can do as much, as you want to do. And
should I do all 30 minutes at once, or can I break it up into different sections?
No, you don't have to do all 30 minutes at once. You can split it up, maybe 10 minutes each time, maybe 3 times a day. You could do some in the morning, some in the afternoon, some in the evening. Just kind of break it up so you're not doing so much and getting yourself so worn out at one time. Do you have anything else?
Do I do that even like when I'm at home, or do I do it just when I'm at the rehab center working with you?
Yes, I would definitely say you need to do these exercises at home.
Every day?
If you can do them every day. You don't have to do them every day, just as much as you feel like doing. And if you're only coming to rehab twice a week, so if you could do just at least some walking exercises, maybe doing the short distance walking where you're walking back and forth just repeatedly, just practicing that, kind of just building up your endurance. Those would be great ideas for stuff that you could do at home. And also just the practicing sitting and standing, sitting and standing, sitting and standing. That's great. That's a great just little workout. Same thing with the stepping up and down. If you have a step stool or something that you do,
yes,
that practices you with your balance as well as your endurance and building up endurance. Do you have any other questions? Do you have any questions about the valve holding chamber or anything with the medication?
How long should I breathe in whenever I'm using the inhaler?
Oh, that's a good question, because I think I kind of left that out when I was explaining. So you're going to want to take a deep breath in when you actuate your medicine. You're going to take it and hold it for about 10 seconds.
10 seconds?
Mm-hmm. Just count to 10. And you just want to hold that in there and let that medicine have time to get down into your lungs real good.
And how many times a day with this one?
You can do that however many times a day you want to do it. If you do it once an hour or once every couple hours, however much you can feel like you can tolerate is good. Just so you're doing it some and just exercising those lungs. The more you can do, the better we can get those lungs in shape, okay?
And you did say Tuesday and Thursday at 9 a.m.,
Yes,
right?
and we want to remind you, yes, every Tuesday and Thursday at 9 a.m. is going to be your times, and that will start, today is Tuesday, so you'll come back on this Thursday, okay? And we'll finish up around the middle of December.
And you did say 6 weeks, correct?
Yep, for about 6 weeks, okay?
Okay.
All right. Well, I'm so glad you came today, and we look forward to seeing you on Thursday and getting more of these exercises, and we'll really work on those exercises when you come back. Today was just sort of like your first initial visit and giving you a rundown of some of the things that we'll be doing, okay?
All right.
All right. Well, it's good to see you, Miss Harb, and we'll see you on Thursday, okay?
Okay.